Joining us in our newsroom, we are so happy to have Dr. Susan Bailey, the president of the American Medical Association, to talk about a very important issue, Thanksgiving, and the gravity of the situation in terms of gathering for Thanksgiving. So, Dr. Bailey, thank you for being with us.
Thank you for having me.
We are seeing the highest number of COVID cases to date, more so than in the summer. According to Johns Hopkins data, 1.2 people, or I'm sorry, a person is infected every 1.2 seconds in the United States, or is infected with the coronavirus. The CDC says these next 6 to 12 weeks are critical, the darkest time of the pandemic. So we understand you, the American Medical Association, along with your colleagues from the American Hospital Association and the American Nurses Association, released an open letter to the public. Please tell us about that open letter.
Yes, medical professionals all over the country, from the AMA, the American Hospital Association, the American Nurses Association, with similar sentiments from the Centers for Disease Control, are issuing a concern that Thanksgiving this year needs to look very different than it has in years past. We have seen surges of cases after every holiday since the pandemic began. And having Thanksgiving in the middle of our record-breaking surge as it is, we're afraid is going to set our country up for a really dramatic further increase in cases and then deaths. So we're asking folks to not gather in large gatherings for Thanksgiving. We know it's hard. It's hard on my family as well as everybody else's. But we want to make sure that this Thanksgiving looks different, so maybe next Thanksgiving will look the same again.
Still, according to a new report, 50 million people are expected to travel for Thanksgiving, 2.5 million expected to travel by the skies. It's down 10% from last year. However, given what we know about this virus and the dangers of traveling, and of course the dangers of large gatherings, what advice would you give to these people who are still considering this or are still going to move forward with their plans?
I think it's important to reevaluate your plans. And if you can change them or postpone them right now, we would recommend that. We recommend that Thanksgiving holiday gatherings just be with small groups of people that live within your household, not people that have come in from the outside. If you are going to be getting together with family that you don't normally live with, you really need to observe physical distancing, staying more than 6 feet apart, wearing masks, washing your hands, and convene outside if you can. We know that outdoor gatherings are less risky than indoor gatherings. But if you can reevaluate your plans and maybe put them off until next year, that would be the best option of all.
People are getting COVID-19 tests beforehand, before they decide to travel and visit their family. However, this might give them, if it comes back negative, it might give themselves and their family a false sense of protection, because we know the results could come back maybe 2 to 3 days later. In that time frame, someone could have contracted the coronavirus. So depending on the incubation period, we can also have false negatives. So can you speak to that?
Yes. That's a good point. Testing is not the answer to preventing coronavirus all by itself. People can test negative, but still be in the very early stages of the disease and still be contagious. So it's not something that will prevent coronavirus without the other measures. We still need to keep our distance. We still need to wear masks. We still need to wash our hands and try to avoid indoor gatherings. Testing can help, but it is definitely not a panacea.
Mm-hmm. Doesn't give someone maybe a free pass to go ahead and move forward. Okay, about 30 seconds. What would you like to tell the country this holiday season?
We are in a very trying time in this pandemic We're all tired of it. We all want things to go back to normal again, to be with our families, to have something to celebrate. We do have things to celebrate. Thanksgiving is a season to give thanks. And I think we need to give thanks for the fact that we do have some tools available to us now to prevent the spread of coronavirus. But unfortunately, that may mean staying apart this year and putting those plans on hold for a happy Thanksgiving in 2021.
Mm-hmm. Well, you put it such a great way. Yes, it is a trying time, but we still have things to be grateful for. Dr. Bailey, thank you so much. It was such a pleasure to have you with us.
Thank you.